43 million people are without health insurance, and the number is growing. Some Americans are choosing a different course, taking health care into their own hands and outsourcing it to foreign countries like India. They get treated for a fraction of the price here.
It's first-class surgery at third-world prices.
India is the best and always will be. I've got no complaints there whatsoever. Very good.
They're just some of the thousands of international patients who fly to India every year for medical care. About 1,500 are Americans, like Rod Watkins of San Diego, a kayaker and a diver. He was told he needed hip surgery, but his insurance would not cover the $40,000 cost, so he flew to India.
I don't think you have a choice. If you can get equal quality care someplace else for less than half the price out of pocket, why wouldn't you?
At the Wockhardt Hospital in Mumbai, Rod had his hip joint reshaped and resurfaced. It's a procedure approved in the U.S. by the FDA only this year, and most surgeons here have only done a handful of these operations. Rod's Indian surgeon, Dr. Kaushal Mahan, had trained in the U.K., and he's performed about 300 of these surgeries.
This idea that only the best is in the States is really fallacious.
His total bill, less than a quarter of the U.S. price. He paid $8,000, and that included airfare and a 10-day hospital stay.
I think I made the right decision.
James Agee, a builder from Hawaii, is in India, also for hip resurfacing. He's impressed with the Wockhardt Hospital, not just the 4-star hotel-like hospital suite, but also the immaculately clean hallways and the attentive nursing staff, especially on the day of a surgery.
The nice nurses, who were my surgical nurses, leaned over me and said, "We'd like to say a prayer for your safe return back from the surgery." And I thought that was really cool, because that would no way happen in America. It just wouldn't happen.
You get a level of care and personalized attention which is truly Asian.
Vishal Bali, CEO of Wockhardt Hospital, says India is poised to become the global doctor. He says most of the physicians are highly qualified and trained either in the U.S. or the U.K. Almost everyone speaks English, and many hospitals like Wockhardt are already accredited by the Joint Commission. That's a U.S. organization that sets the standard for thousands of hospitals in the United States. Wockhardt is also the only Asian hospital to be affiliated with Harvard Medical.
That itself is proof of the fact that Wockhardt follows global norms in terms of its healthcare delivery.
The American Hospital Association cautions that going overseas for surgery can be risky. Patients need to realize if something goes wrong, malpractice laws in some countries limit damage awards. Experts say patients should carefully research hospitals and doctors. But Bali insists low prices and quality care will continue to bring international patients.
Oh my goodness, in 3 or 4 days I was, walking with no limp, no pain. It's been super.
For Margaret Mason, a nurse from Nevada, Wockhardt presented a low-cost option to the high deductible on her $40,000 knee surgery. Just a week later, she was recuperating on a floating houseboat, sightseeing with her husband.
We walked on the beach. I was able to go swimming in the pool.
Total cost, about a third of the U.S. price. She paid under $14,000 for surgery, airfare, and recovery.
People in America, it would be really nice for them to know that there are other options and that the care is equally as good as any care they would get anywhere else.
Yeah, I would say to anyone thinking about any orthopedic surgery here that they should consider it very highly.
You sometimes worry because you're coming to a foreign country, but no, everything is fine. They're nothing but professionals.
Many employers are now looking at India and other countries with an eye to shifting their health costs overseas. Some insurance companies are already covering certain procedures overseas, but health experts say the bottom line is buyer beware.